to be here. When I got onto LinkedIn, I decided that it was time to meet other people within the patient experience community. And Meredith Mangold, who's here with me today, we connected pretty early on in my LinkedIn world and journey, and decided to start having some conversations to share with others. So I'm thrilled to be joined today for whatever this conversation unfolds. And so I think where we wanted to start was really just talking about, what we're both patients. I think there's a saying out there that everybody's a patient, and we're patients probably in a more pronounced way than
Right.
others. And so what's empowers us now? And you have this great business Empower Health strategy. So where does that come from?
Great. Well, thank you so much for having this conversation with me. I remember I was really excited when you reached out to me, and I was trying to remember. I think it's been like 9 months or so, and it's been so exciting to watch your journey. And it's always so both frustrating, but also, I guess, empowering to talk to other patients. I kind of consider us like professional patients who, we share our stories, and it's always heartbreaking to hear that we go through so many of the same challenges and experience the same pain points. But at the same time, I feel like when we come together and communicate and help amplify each other's stories, so many other people out there who maybe don't have the platform or don't have, as much experience navigating healthcare. I feel like we can really help people, and especially educate other stakeholders in the healthcare industry how to better serve patients. So let's see. My whole patient journey started in college. I grew up relatively healthy, and I didn't intend to get into healthcare. And then my sophomore year, all of a sudden, like one day I was fine, and then like a week later, I was crashing in the ICU. They didn't know what was going on. And so I had an emergency colonoscopy because I was having gut issues, and they realized, that I had severe ulcerative colitis, which is a form of inflammatory bowel disease, which is an autoimmune disease. So my immune system was attacking my large intestine. So I was on the verge of sepsis. I don't remember the first 2 weeks or so because I think my brain wanted to protect me from the trauma. But so I was kind of thrown into the deep end of our healthcare system. It was not at all what I intended to do with my life. I was studying Arabic in college at Georgetown, and so it was quite a surprise to me. But luckily, I was hospitalized at Georgetown Hospital, so I just walked across campus and was able to have a really great care team there. So I was hospitalized for about 2 months in the beginning, and then that became the start of my journey of in and out of the hospital, in and out of school, trying to stabilize for periods of time. And luckily, I was able to avoid emergency surgery at first, but then ultimately the meds weren't working. And so I had a surgery called a total proctocolectomy. So they removed my large intestine, which is a fun little cocktail party tidbit that I don't have a large intestine. And so I was told that it would be curative, which was not correct. I really didn't realize at the beginning of my journey when I was diagnosed the chronic nature of IBD, inflammatory bowel disease. And I really just had to figure that out through my own experience. So after my surgeries, still wasn't feeling well, still in so much pain. And then, as I'm sure everyone with chronic illnesses can relate, it's so hard to find answers, especially with multi-systemic illnesses, because everyone's journey is different. It presents in different ways. And so after all this, I knew that I wanted to try and improve patients' experiences in the healthcare system so that they wouldn't have to go through all the trauma that I've been through. It took me probably a decade or more. I'm still learning today to figure out how to really advocate for myself, because I feel like we're we grow up thinking, okay, the doctor knows best. I'm going to do what they say. And because of all of that, one of my main goals through both my kind of personal empowerment journey and my professional journey is to really emphasize the need for participatory medicine, um, which is kind of a school of thought that patients should be full and active participants in their healthcare journey. And so one of the things that I love to do kind of personally interacting with other patients is to educate them about how they can do that, that they can, ask questions, they can tell doctors what they want to do with their treatment plan. And so for me, empowerment is that knowing that I can participate in my healthcare decisions and improve other patients' journeys that way too. My company, Empower Health Strategies, as you can see, empowerment is really important to me personally and professionally. So I work with digital health innovators to help them create solutions that are actually meaningful for patients, because a lot of the time these tech professionals get really excited about new tech and want to create something really cutting edge, but they never actually talk to patients in the first place. So, which in any other industry, you think that would, occur. You talk to your consumers, figure out what they need. And so for me, the reason I called my company Empower Health Strategies is because I'm empowering innovators to empower patients to make sure that they create something that will actually improve patients' quality of life, make them feel seen, supported, and empowered. So that was a bit of a long answer, but I feel like
it's
engaging with other people who really understand what that chronic illness life is like and how that, kind of changes your life trajectory. I know that you had, a different career that was so interesting. I'd love to know a little bit more too about how you came into the advocacy space, because I know when we first connected, we were talking about ways that you could engage in the space. And I know we both had a passion for educating healthcare providers and medical students about what the patient experience is really like. So we haven't talked in a while, and I've just seen some exciting things come up on your feed. So what's been going on?
Well, I appreciate that background because I learned more about your story. I think that the things that struck me about your story, you're right. I mean, talking to other patients is also either really, exciting or it's depressing, because you're like, wow, I'm not alone, which is great. But two, this is going on for many, many people. And I think the things about your story that I sort of jotted down was, one is that, you had this, like me, suddenly you had this acute episode where you were Meredith studying Arabic and then you weren't.
Yeah.
And now you went from, I don't even know if Arabic, all the power to you. That couldn't do any of that kind of language stuff. But, I went from that similar sort of overnight getting a virus, going from being an active person to then having chronic fatigue syndrome. And the other part of your story, because I'm a retired veterinarian, I mean, we were taught in school just to be very, we're empowering people. So we're talking about anatomy here, is that, when you do colic surgery, abdominal surgery on horses, there's always a decision about how much of their intestinal tract you can take out that's compatible with life. And I had a client whose horse had a huge amount of their small intestine removed.
Wow.
Because horses have about 70 feet of small intestine.
Wow.
And the colon is about, I'm not going to quote that because I don't know that number. But so this horse had about 3/4 of it removed. And they didn't think it was compatible with life, but he was still alive when I retired. So he was in his 20s. So he's done well. But it's a thing that needs to be managed. And what's also similar about our Venn diagrams is that we have something that's invisible.
Yes.
So no one can tell that you don't have a colon. and no one can tell that I have chronic fatigue syndrome. And so that adds to the layer of being a patient advocate to be understood. And I think that's where I came into this space. So I was lucky enough that my ME CFS is mild. And so I was able to continue as a practitioner. But during that time, I found myself, I've had it 17 years now. During that time, I really wanted to be able to explain how I transformed from that overnight. Now I'm not that person. I'm not that athlete. I can't go running with you. I can't play pickleball. I can't go bike riding. And they don't understand because I was in my day. The athletics in women have changed a lot, but I was an athlete of sorts, and I can't do those things, and it's hard for me to explain. So part of it is to have that conversation of how do we make being understood both by friends and family and then by our physicians is critical. And I have realized during my journey of trying to, like you, be ping pong to various referrals, to realize that my own training in veterinary medicine didn't prepare me for that four-legged patient to sit in front of me, that the owner would say, boy, they don't feel well. I know that, but all of my physical exams normal, the blood work examination normal, any other diagnostics I do is normal. And then what do I do?
Right.
I wasn't trained with that. And I want, as we've talked about, as you mentioned, I would like physicians to realize that they're not going to be able to fix everything. And that's an unrealistic hurdle, but we still need to have some care, and we can have that care in a chronic basis. So that's getting that level of understanding when chronic illness is in the room is what sort of my lane.
And imaging and labs don't tell everything. It's your lived experience. It's those unseen pain points that I think are so important for us to talk about, making the invisible visible. And that's also what I do working with digital health innovators, is to say, hey, you don't see, the moments where IBD patients are alone in the bathroom, just crying and, sometimes, just wishing things could just be over. And it's so hard. Can I ask if you had like a grieving period when you got sick and kind of that loss of identity? Because it's something I still kind of struggle with today. I had my career track since I was like in high school, knew what I wanted to do, very type A organized person. Especially growing up in this DC area, you're supposed to like know what you're doing and go for it. And I was also like, part of my identity was feeling comfortable writing and speaking and really engaging with people. And now all of my conditions have chronic fatigue and brain fog as symptoms. And I just feel like a lot of that I've lost. And so I feel like that's part of my identity that I've lost, and I still grieve for. But at the same time, I am thankful is not really the right word, but I have learned so much about myself and what's really important in life because of my journey. I almost died. And so now I know I don't want to do anything that is not truly meaningful for me, even if it doesn't really meet other people's expectations. So did you have that kind of grieving moment?
Yes, totally, Meredith. And I found that, so even though I was able to work for about 10 or 12 years with the condition, it finally I was at a tipping point. I was aged enough, and I knew that I just didn't want to have anything happen to a horse underneath my care. So I retired, and I retired, for me, it was early. So that loss and during that time, because my disease was invisible, my clients didn't know. And that was a good thing, because then I could continue on. But suddenly then it was front and center. And I had lost that image of being a veterinarian, and I loved my career. And I was lucky enough. older, so I'm lucky that I've had a longer runway. But that loss of identity and that loss of control when you're young and you feel like, boy, there's no stopping, and my body is going to just behave, and you're going to be able to move and shake in a way that you want, and suddenly you can't. And then, as you said, the brain fog and the fatigue and those things that are not controlled, they're unpredictable. And that's a lot of a message that I'm trying to relate to, is that time is not something that we can control anymore. So you say, well, boy, I want to have a meeting, or I want to go out, and it's all tentative. And so our identity then there's this there's this tremendous weight of isolation
Mm-hmm.
with chronic illness that then plays into your mindset of what's life really going to look like. And I haven't been able to maintain a partnership with anybody intimately because it's been too complicated to try to explain. And they're like, oh, this dating's going pretty well, is it so far? And I'm like, well, you haven't seen me collapse yet. Let's you talk about the pain points. Let's see me unravel, and then let's see how they're going to show up. And so far, I haven't been successful at it. And so my identity also, I never thought that I would be single at this stage. So it's this sort of full circle. And I think that, so yes. And so one question that I have with regard to digital, I mean, again, my view of it is fairly narrow, so you need to help me broaden that idea. But I think I commented this to you in some email exchange, that I've gone to a couple of conferences and they're talking about patient portals, and the overuse of that by patients. But I know that I was never taught, okay, here's our patient portal, other than here's the portal, make sure you get on with a password, and then short of the message that pops up that says, if this is an emergency, go to the ER, there's no directive that says, don't do this, don't do that, this is your limit, that kind of thing. And now I'm hearing in two different scenarios where this is adding to physician burnout, because we're using the portals like email, and now their inboxes are full, and so it's defeating the purpose. And so what are some of the strategies that you feel like that's going to help that, if any?
Yeah, I mean, and to be transparent, I'm not like a tech engineering specialist. I kind of consider myself the humanities side of digital health. So bringing that human perspective and actually what the lived experience of patients is like using these tools. The long and short of it is, I'm not sure that there's an easy fix, because anytime we're introducing new innovations, there's a process of figuring it out, but also our healthcare system is already so fragmented and disjointed, and physicians, healthcare providers already have such a burden on them. They have 15 minutes maybe with the patient, got to go all day long, and then afterwards they have to deal with prior authorizations and talking to insurance companies to say, no, my patient really does need this medication or this imaging or this lab work for us to figure out what's going on. So in my experience, and I've heard from other patients, some healthcare providers and health systems are starting to charge for patients contacting their provider. And one of my doctors, who's the main one that I would communicate with most, I was asking her, okay, are you guys going to be charging me? And she said, well, the clinic administrators want me to, but I only really message her with a list of, okay, these are the things I want to talk about during my appointment. This is a brief update of what's been going on since I saw you last month. So it does definitely contribute to physician burnout. But still there's the problem of communication between patients and providers, because, getting them on the phone or just having to wait to talk to them when you see them in office is really hard. So I feel like there's no easy answer. That's one of the reasons why I really believe in collaboration and bringing as many stakeholders into the room, to the table, as much as possible. That would be a great world, right? Where we could get providers and innovators and, insurance people and biotech people all in the same room to say, okay, what can we create that helps all of us and facilitates a more fluid, effective, compassionate healthcare system. So the answer is, I don't know.
Well, but you brought up one comment that I'm interested, so that with your own practitioner, you sort of send a list of the kinds of things that you want to cover. So is that one way? Again, it's to provide a personal approach that these are the things that are on my mind.
Yep.
And I know that technology, I'm old enough where I didn't have a cell phone when I was traveling. But having people sort of give me a heads up so that I could think about it ahead of time is very helpful. So is that one of the strategies with regard to personalizing this portal? Like, I'm going to see you next week, looking forward to it. These are the things that are on my mind, so that they're not coming into it completely blind, in the sense of if there's something new in particular, that brings it to a personal stage, I would think.
Exactly. I feel like that's one of the main kind of empowerment tools that I've learned and acquired for myself, because I want to honor her time and just give her an update. And also, so in the, when you're in the moment, you're in the appointment with your provider, and of course you're trying to answer questions, and then you inevitably forget to ask them about a really important thing. And so I always like to send it ahead of time, both for myself so I can get in the proper mindset, but also for my providers so they know what to expect. But it's taken me over a decade to realize that that's a really helpful thing to do. And one of the main documents that I've created for myself is my medical resume. So it has, my diagnoses, my surgeries, my medications, the providers I see. And it's especially helpful when I'm establishing care with a new provider or connecting with providers who are like in different healthcare systems so they can know what's going on. And so I'd say 99% of the time, they say, wow, this is really great. Thank you so much. Because, especially with chronic illness patients, we have so many records. And so that's one of the things I send via the portal too, so they can just upload it to my chart. So I feel like there are ways to figure out what works well for patients, what works well for providers, just by having that conversation of, okay, would this be helpful for me to send this to you ahead of time so you can start thinking about it? Or, do you just want to talk about it in the moment? But that's worked really well for me.
That I like that. And it's interesting because I think what you just said makes a lot of sense, what works for them, because I think back to my journey of where I was going to so many physicians and getting no answers. There wasn't a test, there wasn't an image that was popping up anything. That then my file that I brought along with me was very big. This is pre-portal time. So that then I would arrive and I would sort of say here, and I would hand it to them. And I feel like in some ways that probably was a mistake, because I feel like we had 15 minutes and they're looking at this big file. And by now the top 10 differentials have been completely ruled out. I don't have Lyme. I don't have this. I don't have mono. I don't have fibromyalgia. And then they're like, well, I don't know what to do. And I think getting back to what I was talking about earlier, that if in my own training, I wasn't trained to be able to receive that big document in a confined, pressure-filled exam room time, that says, well, no wonder I was very commonly then referred to somebody else, because I don't have time to go through this. I'm not sure if I'm going to be able to get through this, and I want to help you, but I don't know how. And so I'm just going to pass you on. And I think that in retrospect is a part of my journey that I would be interested to sort of reflect that maybe I did more harm by being organized. It's hard to know, but I think.
What else could you have done? You want
Well,
to
right.
empower them with, the information that you've already gone through, all the testing, so
Yep.
they don't do it again. But it's true. I don't know. Have you ever seen like an integrative physician who usually has longer, appointments, and they actually review everything?
Yep.
But of course, they're all out of pocket.
Right. And I think that gets interesting to the sort of the lane that I'm trying to follow in on is this concept of time and understanding that, yes, as you just said, you can go to somebody else and have a longer visit. For me, sometimes, just like you, when we talk about fatigue, I get tired and then
Yeah,
but the good thing is that they may see, if I'm there long enough, they may see me change. And
exactly.
then they witness. But the
Mhm.
other concept that I'm really been working on is if the structure is such that there's 10 or 15 minutes for a patient to be seen, and if that's where we land right now, and it's too hard to unpack that, then I actually would love to have the telehealth be integrated into a more standardized program or series of appointment scheduling for people like us, where
Yeah.
our conditions are relapsing and remitting. We can't control when they show up. And they often, if we have to come into a clinic appointment, we're having a pretty good day. We're well enough to get there. So
Yes.
I would love to instead have a series of appointments at different days of the week and times of day, so you
Yes.
have a greater probability of catching us when we're off, and then the clinician sees us. They
Yes.
then have a better chance to believe us, and then they realize, okay, wait, this is happening.
Yes.
Then we have some common ground on which to then, may not fix us, but they
Right.
can help manage us better.
Exactly. You said so
Yeah.
many things that I have thoughts about. Let's see if I can remember them. But I think that's kind of one of the good things that came out of the pandemic is the accessibility to medical care through telehealth. Because yeah, I'm in the same boat. I was actually bedbound for about 3 years recently, and I couldn't go to appointments. I'm still not driving now, and like you said, I have really severe chronic pain, and some days you just can't function. I couldn't get out of bed. And I finally, about 2 years ago, um, put together a really great multidisciplinary care team. And I mean, I've seen all the best doctors here in DC, and still each one's got to the point, especially pain management, who said, I don't know what to do with you. I don't know what to do with you, passing me on. And so I found a great multidisciplinary care team at Kennedy Krieger Institute,
Mhm.
which is like the PEDS specialty hospital associated with Hopkins. And because they were helping me with my Ehlers-Danlos syndrome, which a lot of people, physicians don't really know much about. It's a connective tissue disorder. And I remember for my first appointment, which was telehealth, luckily, because it was right in the middle of the pandemic, I was lying down over there at the little banquette we have at our table. I could not sit up at all. I could only lie on my left side. Sitting up was so painful. And so they saw me in my element, what my everyday was like. And now, like 2, 3 years later, I have a follow up with them this coming February. I saw, they saw me, I can sit upright. I am, engaged. And for so many years when I was bedbound, I had no hope that I'd ever have any kind of fulfilling life ever again. And so just for them to be able to see me in my environment, to see how I progressed, is really exciting. But at the same time, I've been talking with patients about this all week, that you you don't want to you want your provider to see you as you are. And so sometimes, you don't want to look great going into an appointment. Like sometimes,
Right.
I want to put on lipstick or something just to be like, okay, war paint, let's go today. But if you look good, oftentimes, unless you have a really great provider who knows you and invests in you and really wants, they'll just be like, oh, you're looking great, especially because of, invisible illnesses. And so that's a really difficult thing to navigate. I was talking to a patient the other day who was saying something to the effect of, you don't want to come off as really too smart, that sometimes you have to come off a little bit dumb to be taken seriously by a provider, which is so sad. But sometimes that's the case.
Yeah, I think it's just really important to be able to get that full picture when, especially when you're dealing with a chronic illness that then affects all aspects of us, our home life, and who's helping us at home. When you're bedbound, who's there for you? Because if there's a dog and a cat, my dog and cat are lovely, but they can't get groceries for me. They, all of those things. And then it's a partnership. Then they're starting to have some places again for there to be help. It's not curative, but if this is our new life, this is our new identity, we want to be able to be as functional as we can. And
right.
Getting that window, especially if we're seeing a new provider for the first time, they're just not going to get to know us. And we can honor that 10 minutes, as I said. I just think that there's other touch points to follow up. The in-person is very valuable, extremely valuable, but I also think that the telehealth can be leveraged in a way that would make us less likely to have, we can have multiple providers, but we don't need to be bounced around as much. And it just doesn't help either one, because I know part of my joy as being an equine veterinarian was knowing what happened to my patients.
Yes.
And if you're referring people like us, then you may never know.
Right.
If you didn't have that continuity of your care team to know that you went from the you being bedbound to then being now vertical, that's rewarding for them.
Yeah.
And so I just think those are pieces that I think can empower the whole sort of collective.
Right.
And so we've got.
And another
We just have a couple more minutes, and so I just go ahead.
Cool. Yeah. Do you have a hard stop?
The Zoom does.
Okay, got it. Oh, okay. Wow.
You're fine.
To say, but we got all into the personal stuff. But so one of the big trends now in digital health is remote patient monitoring. So, your smartwatch or other kinds of digital devices. And so that's another way for your providers to see what's going on with you when you're not in the exam room. However, that also leads to the same kind of overburdening providers with information. And so that's why one of the main things that is essential for digital health solutions is interoperability, so that they can integrate with their EHR systems. And
of course.
And otherwise, it's just some other document that you have to send through the portal. So that's a big trend right now, as is APIs, which are application programming interfaces. So people are building platforms that give you access to your various portals all in one place. And so it's been interesting to talk to those innovators and to help them realize, okay, what's meaningful from a patient perspective? What information do they really need? And some other innovators that I'm talking to are trying to empower both patients and providers with kind of a high-level summary of all your medical records to get, your hundreds of pages and see, okay, boop, 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 this is what you need to know. So for me, that's one of the most exciting, I think, things on the horizon, because especially with people with chronic illnesses, that's so important.
So that they would be looking through a document and be able to pull out some of those high-level pieces. And I think that would be very valuable, because you identify trends and other things that, this happens these days, and what's happening on these particular days of the week, or that's why are you getting triggered? And that could then be able to more normalize things. So I think I share that excitement of that piece. And I feel like some of those home monitoring things, again, I'm less tech. I haven't grown up with technology, so it's a little clunky for me. But I think that those are things, as long as they don't add to for me, the triggering and how much brain activity they use, then I would
Exactly.
be helpful to me. But I think that integrate, as you said, that taking a big chunk of information and being able to filter it down and finding out the doing that word cloud kind of thing of sense of
Yes,
these are the things that are popping up and why are they, and that would help disseminate some information. So,
exactly.
well, I know
Oh,
we when we first met, we could talk for hours, and we've done the same here. And I know that this will be first of many for us to connect and really have thoroughly enjoyed this opportunity to hear more about what you do and how you've shifted your identity in a very powerful way. And you didn't have to. I mean, you could have taken been a patient and then not sort of take the next step, but you're trying to help others, which is really remarkable. And I'm
same
grateful
to
that our
you.
lives have passed and crossed.
That's why it's so important for us to work together, so we can get the message out and help support each other personally and professionally. So thank you so
Yeah.
much for talking to
Okay.
you. We
Thanks so
learned.
much for your time.
Thanks.
Okay. You take care. All right. So we've been talking about really helping, empowering your patients. And so I'm interested in some of the ways, what are those barriers, especially within the digital world that you've identified and ways that you're trying to help those minimize those barriers.
Sure. So, like we've already talked about, we already have so many burdens on us to navigate the healthcare system. I always say, like, we have to be the CEO of our health, and it truly is a full-time job. So, if you have, an app that's meant to help you manage your chronic illness, but it's, the design is really complicated, or there are too many things, too many like features that don't apply to you, then it's really overwhelming. And it seems like just another, task in your health management that you have to go through, and it's not actually helpful. So then people don't use it. So you have to make sure that the design of the innovation meets people where they are in terms of their digital literacy and their health literacy. It needs to be in terms that patients can understand. The kind of rule for the level of uh, the sorry, brain fog. So, in order to create things that meet people where they are in terms of their health literacy, is to have the information written at like a fourth to sixth grade level. And so, if you have a solution that is really technical, then it's just gonna fly over people's heads. And and so then there are also barriers about privacy and trust, especially in relation to data. Patients are, nervous to get their data out there, their trust in the company. What is this in my best interest? Am I going to own my data, or is it going to be sold? And so people feel really hesitant in that way too. Also, like I mentioned, in terms of the customization, was this like created with me in mind? Or is this something that just physicians or tech people think is helpful for me.
So
And then,
how do you, if you have these worlds, as we know, the patients are at home and the
yep.
tech people are in their offices and clinicians are over here, how do you get those either in the same room or the
Mhm.
voices in the same room? How are you, what have you found to be successful to do that? Because that's so critical, but so hard to do.
It's so hard. And that's what I'm trying to do with my business, is to get as many stakeholders in the same Zoom room as possible. So I think of myself as a patient experience and engagement strategist. So I connect with digital health companies and show them how to meaningfully engage patients in their innovation process. So obviously the ideal situation would be for patients to work with them from the very beginning of the innovation development process, and then to be able to give guidance throughout as they iterate their product to make sure it's really meaningful for patients. And so, like right now, I'm working with a startup company that is I help them create a pilot program to try and bring on what I have called patient pilot partners to really engage them and give us feedback on what their journey is like. And so we can really understand what are the main pain points. If you could create one thing that could help you with that pain point, what would it look like? And so the reason I wanted to work with these innovators is because they really get it that in order to create a successful product, they need to include patients from the very beginning. And we are learning so many valuable things from these patients. And it's sad that I can always anticipate what their pain points have been throughout their experience, but it's very interesting to see how people want different kinds of tools. But there's this, a Venn diagram, and there's a lot of overlap. And so we're getting really meaningful information. So I help create like these pilot programs, create internal patient advisory boards, external feedback panels. I help organize and facilitate patient co-design workshops. So say an innovator wants to know how they should build their symptom tracking feature. I bring patients into the Zoom room and say, okay, what is helpful for you? What isn't? And then I also help innovators create more customized user satisfaction and feedback surveys, because a lot of times they're good at, quantitative information, like NPS surveys of, rank X, Y, and Z.
Right.
But it's really hard to get meaningful qualitative data. And so one of the things that I think is so important is to really engage with the patients and learn more beyond the, like 6 out of 10, this is helpful, is to realize, okay, how are you using this in your daily life? How helpful is it? What are some things you'd want to improve? So really my job is to be the bridge, the facilitator between patients and these innovators, and to get them to talk together to help innovators create something that's really meaningful. And therefore, patients will want to engage with it. That drives, user engagement and long-term retention. So ultimately, it's helpful for everyone.
Wow, that's a powerful bridge. And all I'm thinking about is when you started off this conversation about the fact that there's so much medical knowledge that is intertwined in this,
Mhm.
that having patients be able to learn how to articulate that. I mean, I feel like I've have the I don't know if advantage is the wrong
Right.
word, but I grew up I was trained in the medical community. So these are terms that are readily sort of something that I can use. But
Hmm.
if you're suddenly overnight, like you got sick overnight, you were studying Arabic and now you're this, you didn't have that breadth of medical terminology. You didn't take
Yeah.
medical terminology as a
It was a
class.
crash course.
And so and part of that is the lift for a patient is this fear of I don't understand even the terminology, and being
Yeah.
able to not, as you said, to get the explanations to a level that doesn't, it's not demeaning, it's just
Right.
making it practical in a language that then they can really understand, so they're not saying yes to something that is not what they really want, but they don't really know what it is, and they don't want to admit that they don't know. So they
Right.
say yes, and then now they're doing something that's scary or other things. So there's
Yeah.
a lot of emotions and pieces in what the simple formula that you're describing, Meredith, is very complicated, and I admire even more because you get you bump into all of these kinds of barriers, of one barrier being, do they understand basic piece? You have technology and you have medical world, which are very complicated,
Hmm.
separate, and you're trying to bridge them, which is
Right.
yeah.
And yeah, several years ago, I was working with a startup that was creating a mobile app for inflammatory bowel disease patients, which I have IBD.
Hmm.
And we were interacting a lot with the users through an AI kind of chat feature. And I was so surprised, sort of, that so many of them did not know the like what IBD was, what it was affecting in their body, why they're taking these certain treatments. And so that was why we created kind of a resource hub so they could message in and say, hey, why am I taking this medication? And we could say, hi, here's some, medically verified information to explain what's going on in their bodies and then how they can then take that knowledge to advocate for themselves. But we'd also provide insights from other patients to say, hey, I'm struggling with, abdominal cramping today. And, we could say, hey, I'm so sorry you're experiencing that. I know how hard that must be. Other patients who have, your diagnosis or taken this med, whatever, experience the same thing. Do you want a piece of information, an article, a blog from our patient ambassador, Amanda, who shares similar, symptoms with you to see how she navigates this issue. So it's important to also feel like people really responded to like peer information because it's not just clinical. It's okay, I know they're living it and how they can empower themselves through that. So education is really important, and I
Oh,
think tech is a great way to do that.
that sounds marvelous because you're right, that peer-to-peer, it's just like, reviews on Amazon or other things.
Yeah.
We look at it and it's meaningful for us, but then did this happen to you and how did you get through it? And then I'm thinking it stops you from getting on the portal and sending another message to your physician that then
Right.
adding to this big compilation of messages that then is not helpful and isn't going to get you the kind of response, sort of more intimate or more practical timing wise, that you need. Boy, I wake up and this is what I'm feeling. What do I do? And I think that's very helpful. And wow, I'm even more impressed, Meredith, with what you've done. And when you can do a medical book in Arabic, then I'll be like, okay, I'm done. I'm done. So I
I don't know if I can do that right now.
that's okay. That's
Yeah.
okay. And you don't have to. But I'm
Right.
just the Arabic obviously stuck with me that
Oh,
I did Latin when I was in school for
oh, that's
the medical
helpful.
side
Yeah.
because it's all the word derivations that
Right.
a lot, but it's not
Huh.
Arabic.
I
So
can tell you all about pre-Islamic Arab poetry.
well, appreciate
Random
that.
stuff like that.
Yeah, there you go. You're a woman of many, many talents
Yeah.
and really grateful for any other things that you wanted to add at this point.
I think the ultimate kind of conclusion is even though tech is great and it's helping to, streamline administrative processes, it's helping to connect patients with like clinical trials. It's helping, healthcare organizations to help identify like bottlenecks to help improve their processes and patient flow. We can't replace the human element. So, like you were talking about wanting to message in and say, hey, why is this happening? What we did with the IBD app is to always say, here's this information, but talk to your doctor. They know you best. And, that human element is so important in healthcare because our health is everything. It's if we don't have health, we don't have anything. And I know it's really those physicians and those other healthcare providers who really care that make all the difference. The past 2 years, I found an incredible pain management doctor, and I'm able to see her virtually. And literally at the end of every call, I tear up and just say, you don't know how much you have changed my life. And going from bedbound to, I went to a conference a couple weeks ago. And so I sent her pictures of me at the conference all dressed up, I sent her an email, Pixar didn't happen. And just to be able to connect with someone who really cares for you is so important. So tech is great, but we can never replace the human element, that empathy.
Yeah,
So
and kudos to you for giving that care provider that feedback so that then she knows really what she is helping with.
yeah.
And that's will help her to prevent her from burning out and prevent her from that gives her that satisfaction at the end of the day, knowing, I've really made a difference in her life. You could thank her, but seeing you out in action and doing things that you weren't able to do before, I think those are the things that you want.
Exactly.
And that's where, I mean, I know that that's what I went into veterinary medicine for, is to have my patients, be better, whatever that definition is. So anyway, thank you very much for your time and
Thank
for your
you.
talents, and look forward to continuing this conversation again and getting some updates on some of your specific work. So,
Thanks. Same to you, Carrie. You're
yeah,
making such a difference in people's lives. So thank you for what you do. I see you. And yeah, I would love to continue to support you.
great.